for Research and Policy at the National Head Start Association. Right now you should be able to see on your screen and you should be able to hear me. If you can do both of those things, just go ahead and type yes in the chat box or the question box. All right, great. It looks like just about everybody is doing very well right now. We are so glad to have you with us. Today we'll be talking about budgeting for early Head Start child care partnerships. We were chatting before we got on about how eager we all are to see the funding opportunity announcement, which was forecasted to be out last week, and hopefully we will see this week. So I know you all are as eager for this information as we are to discuss it, and while some answers we will not have until the FOA is out, we will do our best to share some information and address your questions today. I'm thrilled to be joined by a couple Head Start leaders with a wealth of experience between them. We're here with Lassie Tesla, the Divisional Director for Head Start and Early Head Start at Pacific Clinics in California, and Mary Burns, President and CEO of Miami Valley Community Development Center. We're also very glad to be joined today by Trevor Weiser, representing Community Playthings, who are sponsoring today's webinar and making it available publicly. All right, and just a note, yes, this webinar is being recorded. I know that's the most often question we most often get, and it'll be posted on our YouTube channel later today. I'll send out a link when that's available. Just to give you a brief overview of what today's webinar will entail, we'll hear from Community Playthings in just a moment. Then we'll address some background for those of you who may be less familiar with partnerships. We'll hear about budgeting in practice from Head Start leaders at 2 different programs. And as always, when we do these, we pick examples and invite some experts from the field who really can give you a sense of different ways of approaching these issues and topics. Like anything in Head Start, the ways that these partnerships are designed is based on local resources and local need. And there's no single one right way to do it. But we hope to share with you some different approaches that programs have taken that can inform your thinking about what might work in your community. Then we'll make sure you know where the latest resources are, and we'll take some questions and answers. Here we go. So Community Playthings is a sponsor of ours, and we're thrilled to be working with them. They believe that classroom environments can powerfully affect children's learning and development. For over 65 years, they've been creating beautiful wooden furniture and toys for children and have been pioneers in promoting quality in classroom and play equipment. Today, we're delighted to be joined by Trevor Weiser. Trevor?
Hi, Emily. Thanks so much for the introduction. And it's certainly good to be on with so many people today. And just for those who aren't maybe not familiar with Community Playthings, Emily gave you a pretty good intro to start with, but we have been making high-quality furniture for child care centers for nearly 70 years now. And also in more recent years, we've begun a process of planning for child care centers, which has been very successful and very popular. And when you put the two together, you get some tools which are turning out to be quite useful for folks as they plan their budgets and write their grant applications for their early Head Start child care partnership grants. So I wanted to just highlight those and make sure you're aware of them, make them available to you today. So we can go on to the next one, Emily. The first, the most sort of easiest to access are our sample classrooms, which we have available for download on our website. And those include a floor plan like you see here. And on the next slide, we'll see a 3D rendering of a child care space. And then as well as a price list for your budgeting. And this is the part that a lot of folks seem to be very happy with, that everything that you might need to open a new early Head Start classroom is just kind of lined out for you right here. And basically, it's a way that we found to take some of the work off you and also allow for clear and consistent communication both in your grant application and your budget and to a potential partner. So that's one tool we'd be glad to make available for you to help you as you begin this somewhat daunting process of writing your budget and preparing your grant application. And then, of course, those sample classrooms may not be perfect for your situation. You might have a smaller space or a larger space. And we also do something similar where we'll customize to your space. Just if you send us your floor plans, our planners will work with you to create a space that's just the way you want it. And of course, the 3D renderings allow you to preview it and decide if that's really how you want it, and trim a bit here or add a bit there. And again, as a way of communicating, especially with a potential child care partner, this could be very useful to you folks as you make your plans. And also, I don't know how many will find themselves in this situation, but some of the folks in Early Head Start I've talked to as they prepare to partner are wondering how to incentivize the partnership so that their partner is eager to come on board. And I think this would be a great way to do it, to present a possible classroom, or even a corner or an area of a classroom which you could provide for them. And it's a win-win situation. The partner, your potential partner, is faced with the possibility of getting some really high quality equipment, and those of you familiar with community playthings know that when you buy this furniture, you buy it once, and that's something that could be very valuable for a potential partner for a long time to come. Next slide, Emily. And then just to also make you aware, we have additional training resources for staff development also available on our website. This is our booklet on infant and toddler spaces with some articles and information on how to design a quality space, something some of you may be able to make good use of. Next. And so we hope those can be useful to you, and I also just want to take a moment to acknowledge the work that you folks all do. I've had the privilege of working with a lot of Early Head Start professionals, both at NHSA and in the recent weeks, and I see a lot of people doing a lot of good work, facing challenges, facing difficulties, and serving some of the children that need it the most. So thank you so much for doing that, and if these materials can help you, we'll be very glad for that. You can go to our website displayed there for more information, or there will be an opt-in at the end of this webinar if you want to receive more materials from us that would include those sample classrooms and the booklets for professional development. So I invite you to make use of those, and we certainly hope we can be of use to you as you do your helpful work for children in our country. So thank you very much.
Thanks so much, Trevor. We're glad to have you with us and appreciate your support. Great. So moving on to a little bit of background. Just for I know I've recognized a number of your names participating with us today, but for those of you who may not have as much background or who are considering coming in on the partner side of this process, just wanted to offer some information about the history and what we know about Early Head Start Child Care Partnerships. Just this last year, about 67 Early Head Start programs had family child care partnerships and 130 had center-based child care partnerships. Together they served close to about 6,500 children. And really that's there to emphasize that this is something that some programs have 20 years of experience doing really since the advent of Early Head Start. But that this funding opportunity provides us a great opportunity to scale some of that good work and learn from what's happened before to really try to reach more infants and toddlers and their families who are in need of high quality care in their communities. Whether programs use family child care models or center-based child care models varies based on who's in their community, who's located in the neighborhoods where children are most in need of these services, and what resources can different partners bring in different areas. Research on the existing Early Head Start and Head Start partnerships has shown that when child care settings partner with Head Start, they show increases in quality over time, expanded access to family support services. Often these are because of the kinds of resources that programs were unable to access previously, and that while they were committed to meeting the needs of children and families, they didn't have the resources to do so. but through the partnership with Head Start, they gain access to those sorts of things. And importantly, the research shows that the partnerships were most effective when they were planned over a longer period of time and had clear written agreements and strong communication systems between partners. So as I know Mary and Wasi will mention some of their process of negotiating later on, that really comes into play, that this is a thoughtful process and that both sides understand what they're bringing, what they're gaining, and how they're contributing to the partnership. Just a little bit more background. The partnerships were first developed 20 years ago when Early Head Start was created. If you missed it, last weekend was the 20th anniversary of Early Head Start. And on the Clinton's Foundation blog, we had a blog post from a really amazing Head Start alum who had just graduated college the day before. We called him up and said, you know, are you busy? Can you help us with this? And he said, well, I'm graduating summa cum laude, so I'm in the process of planning the baccalaureate ceremony, but sure, I'll write that. But so I encourage you to check that out. But so that's how old Early Head Start is now, and we've been learning from partnerships for about 20 years. In 2013, the partnerships were included in President Obama's Early Learning Initiative. Some of that has become the Strong Start Act, and while that act has not passed, it does also include some language around the partnerships. But because the partnerships would be operated through Early Head Start, which already existed, they didn't require Strong Start to be passed in order to be implemented. And so in 2014, $500 million was allocated for Early Head Start expansion and partnerships. Exactly how the funding opportunity will describe the opportunities for expansion and partnerships has been a standing question, and one we look forward to learning more about how they've chosen to do that in the FOA when it's released. The President has requested $650 million for partnerships in 2015. Our current understanding from the way the grant forecast is written is that if additional funds are allocated in 2015, more applicants from this current pool could be funded later if there's more money available. And the funding opportunity announcement, again, is expected momentarily, and we'll share some links on the screen at the end about where you can look for that information as we await it breathlessly. All right. So with that said, hopefully that gives you some background if you weren't familiar with partnerships already. And we're about to get a lot more in-depth information from our two speakers. First, I'm pleased to introduce Mary Burns from Miami Valley Child Development Centers. Mary?
Hi, everyone. First of all, with all of you on the call, I'm sure some of you are more experienced than I am at this, but I'm happy to share what I can.
Oh, Mary, actually,
yes.
I forgot to do our poll. Do you mind if I do that before you start?
No.
All right. Here, let me just pull that up. So we do have one question because we do want to get a sense of who's on with us. Hang on, let me just pull that up. I seem to have closed my own window. All right. So just to get a sense of who's on with us, you should see right now on your screen a poll about child care partnerships. And I would invite you to respond, even if you only have partnerships for Head Start, let us know the kinds of partnerships you have. You can check more than one box if you'd like, or if it's relevant. The options here are family child care homes, center-based child care, campus-based, meaning with a university partner or a community college, yes with some other model, or no, but I'd like to. Okay. Give you all one more second. All right, so I'm going to close the poll there and share with you the outcomes. So we do have a good mix. It looks like about 55% of you, a little more than half, do have partnerships in a mix of types. And close to half of you don't have partnerships yet but would like to. So those of you who do have partnerships, Want to chime in later during the questions if there's something that you do differently from these folks that you think would just be interesting to mention. We do certainly invite you to share your wisdom. And with that, I will turn us back to Mary.
Okay. I just wanted to tell you a little bit about our agency. I didn't put our numbers in here, but we serve 2,283 preschool children, and we have 388 early Head Start children in a 3-county area. At the present time, as you can see there, we have 12 contracts with private child care centers for preschool, and they serve about 265 children. We have a very limited family child care partnership with four providers right now. And then we also have a lot of partnerships with different school districts serving state-funded children and state public preschool programs for the districts. In preparation, next slide, I guess. I think Emily's got that.
Yep.
Okay, in preparation for this new grant, what we did was we approached several of the preschool partners about adding infants and toddlers. We went out and we reviewed their licensing reports, and we've gone out to start to assess the appropriateness of their space for infants and toddlers. That's going to be one of the biggest challenges for us, I believe, but all of them are very interested in working with us. We do plan to partner with some star-rated centers. In Ohio, we are on a quality rating system that has 5 stars. And initially we thought, oh, we better just go with the high stars, you know, because we don't want to cause ourselves trouble. But then we thought the whole intention of this is to help those child care centers improve. So we're going to go with some who are not yet rated but have agreed to, who are interested in doing so should we be funded. So what we require for our partners, and this isn't everything, of course, but Emily invited us to list a few things. So, of course, the teachers, we do require a minimum of an associate degree in early childhood, and we look at that through transcripts and degrees to make sure it's the proper degree. We ask that they have some evidence of quality rating or a willingness to start the process. And we have helped quite a few of our partners already get into the process and get star rated, at least at the 1 or 2 level so far. So I'm hoping they can keep moving on this. We also ask for evidence that they're using the Child and Adult Care Food Program, and we look for documentation of their insurance at their site, including workers' comp, liability. I didn't put child accident, but of course child accident insurance. So we ask for all of those things to be done ahead of time. Okay, Emily. Well, there's child accident insurance. We also, well, we pay, I'm sorry, I messed up there. We pay for the child accident insurance. We ask for their other insurance claims, but we pay for the child accident insurance. And then we also pay the online fees for child assessments. So whether they're using Teaching Strategies Gold, which is quite popular in Ohio, or if they're using HighScope, we pay the online assessments. We make sure they have the computers necessary through the web-based program. That's part of what they will get as part of this project. In our case, we assign a family support specialist to assist with enrollment as well as health and social service support. And our family support specialist is expected to be at their child care center on a regular basis, if not daily, every other day or so, to check in with the parents either at the drop-off time or the pickup time at the child care center. We also have ongoing teacher support. The centers pay their own teachers, but we provide ongoing teacher support through assignment of an education support supervisor, not somebody who does their evaluations, but more of a coach, a mentor, somebody who can help them with the curriculum in their centers. And then we also include them in our ongoing monitoring and our own agency outcomes work. We have a very extensive ongoing monitoring system that looks at factors across all the component areas. And we include our partners in that process just like we do our own centers. They end up getting quarterly reports with dashboards and benchmarks and everything noted, so we can compare their work with the work in our own locations. Okay, Emily. We also include anybody from the Child Care Center is welcome to come to any training that we have. We do that at no charge. If they can afford to send somebody over, whether it's an infant teacher, a toddler teacher, a preschool teacher, we don't Doesn't matter, whatever their needs might be. And we do make sure that on our policy council, we have inclusion of parents from different partnerships included on that possibility. One thing they really like are the network meetings. They meet once a month right now, but at times we bring them in for special meetings around the class or around classroom assessment so that they can get some better support with each other. And then finally, and probably most important to this conversation, is we offer them a financial reimbursement that will be matched with their child care subsidy in order to ensure high-quality comprehensive services. So with our preschool partners, we've been giving them what we call enhancement dollars, so much per child per month. And with this early Head Start grant, we're looking at probably a more generous contribution because the cost of infant toddler care, of course, is much higher. So we're going to try to match, hopefully, what they get with child care subsidy. So, all right, Emily, I think that might have been my last one, Emily.
Okay, I have one point of clarification for you, just for folks who are less familiar with how partnerships work. When you're talking about funding for children, you're talking about particular children in the partner setting who would be identified as Head Start or early Head Start enrolled. Is that right?
Right, exactly. And it doesn't mean, like I gave an example to Emily earlier that, you know, we have one partner that, believe it or not, has 90 infants and toddlers. Wow. We are not going to partner with her for all 90, but we're hoping to impact her center by partnering with her for about 24 of those children, because we have to carve out the space for the units of 8. But we know that overall that will help her total environment there.
Exactly. And for those of you who haven't heard the administration talk about these partnerships, that's a big part of the idea of leveraging quality, which is that then those classrooms would be meeting the early Head Start standards for teacher credentialing and space and curriculum for all of the children that are affected by the settings, both those funded directly by Early Head Start and those who aren't.
Right.
All right.
So I'm sure there's other questions, but briefly, those are the main things that we do. We have established what we call a partnership agreement that I can make available to Emily to post if you like, but it's basically an agreement about, you know, what we will do and what they will have to do. And we've never had any problems with it. We've had these partnerships for several years now with preschool children. Yeah. And we're not adding infants and toddlers in every single center because, again, we kind of did a really careful review of their licensing issues and their capability with space. And we did, I do think we have that posted already on My NHSA. For those of you who are NHSA members, you can log into My NHSA, and in the member resources folder, there's one called Early Head Start Child Care Partnerships. Okay. You do have 2 questions that are specific to what you just said, Mary. The first says, when you say matched, do you mean that the reimbursement from your agency is equal to the state payment? That is what we are hoping to do. We haven't put the budget together yet, and we haven't seen the FOA like everybody else, but we're hoping to get as close as possible. In Ohio, at least right now, our cost per child for infant and toddler is about $11,000. And in Ohio, they get about $5,500, believe it or not, very low for child care. And that's for full-time care. So certainly if we want them to be of higher quality and to meet the high-quality standards, we're going to have to give them adequate match. We haven't worked all that out, and it'll be done on a monthly basis. We pay on enrollment, not attendance, because they have their costs just like we do. We don't get dinged if we don't have attendance, or if we don't have enrollment. We get dinged only then.
And another question, do you have a different rate of reimbursement for a child who does not receive a child subsidy, or do you require the center-based program enrollment families to be working or in training?
We would not have a different rate because this is supposed to be a match with child care. So, I mean, the whole concept of the grant, as I understand it, is an Early Head Start Child Care Partnership. So I think it's not just it's not just Early Head Start on its own.
And I think that may be something where we see some nuance about whether the actual child who's Head Start enrolled has to be the one receiving subsidy, but I don't know any specifics on that until we see the full in writing.
Most of the places that we have checked already, all of our partners now, it's because the parents are working or in school. Those are the children that we partner with. They don't generally have children all day if they're not doing one of those two things.
All right. So we will definitely have time for more questions at the end. And for the moment, we will turn it over to Wasi Tesfa from Pacific Clinic Head Start and Early Head Start. Thank you, Mary.
Yeah, good morning. For me, it's good morning. So, yeah, so just go ahead with the slide. Okay, Pacific Clinic's Head Start, Early Head Start, we have an enrollment of 600 children, of which 396 are, or 595 children, of which 396 are Early Head Start, and 195 are Head Start children. Go ahead, continue. And what I'm going to focus on is on the Early Head Start. The majority of the children, of course, that we serve in Early Head Start are in home base, about 121 of them. And center base, we have 74 children. As you know, center base is very, very expensive, so having home base helps us really serve so many children in center base. And of the center base, 24 are standalone Pacific Head Start, Early Head Start, which means they're fully funded by our program. 74 we have in a private and in college campus and in nonprofit settings. The private preschool, we serve about 8 children, and these children are children that get subsidies from child care dollars, and so we augment that funding. And for the nonprofit, it has kind of a multiple funding. It has foundations and donors, and also some First Five, but it's all low-income children. All the children there are low-income children, and so the infant toddlers, the 40 infant toddlers, are Early Head Start children. The college, that's the it's a PITC demonstration site, and those are also subsidized through child care dollars, and we augment those funds also. The way we do it, the way we do the funding is a little bit, it's not exactly the same for all of them. There's federal funding, of course, that's Head Start, and then there's the private donors, which is the partnership that I told you about, the one with the 40 children, and then, of course, there are child care dollars. Now, it's not exactly the same formula for everyone. What we do is, you can, I think, continue to the next slide. Go ahead, yeah. So what we do is there's no real formula for everybody. What we do is we look at what the cost of child care is in the community, okay? And then we look at what the cost of child care is for the partner and how much reimbursement they're getting from the state and what kind of funding they're getting from elsewhere. And then we come up, we recommend something to them. We also look at all kinds of different things. For instance, in one partnership, they may not have teachers with degrees. So maybe what they want us to do is really provide them with a teacher. And so that would affect the exact cash exchange that we may have with that partner. For instance, in the community partnership where we have 40 children, it's really because they get funding from multiple sources, so ours comes up to be almost 1/3 of the funding for them. What we do is when we approach partners, I mean, we feel whether we come with 50% of the funding or 75% of the funding, for us to do it alone as Head Start or Early Head Start, it would have been a cost of 100%. So any kind of partnership is a win-win. So if I have to, put in more resources, more funding, more dollars for this one partner, I may not need that much for the other partner. So that's how we do it. The way we cost allocate is really, it's in the MOU, in the Memorandum of Understanding. What is it that we provide as Early Head Start? What is it that the partners will bring? So maybe we would say, okay, we will pay you this much amount. I'm reluctant to say the exact amount because it's really not exactly the same for everyone. And so we'll pay this amount. We will bring comprehensive services. Like Mary, we bring the whole comprehensive services. We do the monitoring. Training is available for everyone. And we have, partnership meetings and all those things with them. And so we'd say we'll provide these resources for you, and these are some of the expectations we have. And so we'll say what the expectations are, the attendance. For instance, with one partner, we do the child care food program for them, which is an enhancement for their program. We just, the state pays for it. We get reimbursed through the state. For their program, they wouldn't have been able to do this because they don't have the infrastructure or other things. So if they don't have it, we won't let that stop us. We will provide it to them. In another case, they may already have child care food program, and they'll say, no, we want to continue with our own, on our own. So that's not an added benefit that we provide to them. Yeah. The other thing is what I think it's very important, for my partnerships have all been, like I said here, center-based. So what is really important is if the cost, for instance, in the private preschool, which is, I think it's the one that I partner with, is about $14,000, and they get so much money from child care, then I will pay that difference. That does not automatically mean that I will give them exactly 50% of what child care gives them. It may be more. It may also be less. So, yeah, you can continue with the slide, I think. Yeah. I think most of mine would come through the discussion because, yeah, the discussion with the, about the MOU and all those kinds of things, because the monitoring, the training that Mary talked about, that's also very important for Head Start, the comprehensive services. That's, that's the thing that we have to look at. We invite the partners also to the Policy Council. They're part of our strategic planning. They're part of our education advisory. And we also have individual meetings with each partner monthly. And with some partners that we have to work more with, we meet more often with them. Our family services associates also are available to them. We have a family service associate that works only with the partners. And in some cases where we have the 40 children, they have a very strong family services program. So the FSA's role is a little bit less minimal than it would be with other partners. And we also, which is also very, very important in partnerships, is we provide resources for playground enhancement, those kinds of things. And there's no real fixed dollar amount to that. It really may depend on what the needs are of this particular partner and what our budget looks like. So that's it for me.
All right, thank you. So we do have a bunch of questions rolling in. I'm going to get through our next couple slides, just letting you know where you can find some additional resources, and then we will get into some of your good questions. So just a few things that we wanted everyone to be aware of, and I'll leave these up on the screen, but we'll also post this webinar as a YouTube recording as soon as it's over, so you will get a chance to look at these later if you don't jot them down. There are some resources here from NHSA. On that website, we've organized a lot of different resources, and the links to everything else that's up here will be up there. And really, that's where we've tried to curate all the different tools and webinars and recordings of things and research studies and everything that you might be interested in if you're focused on partnerships. And we have a link there as well to the Community Playthings tool that you heard about earlier. And then resources from the Administration for Children and Families. Those first two links, the first one is up there now, the grant forecast. The funding opportunity is not yet posted to grants.gov, at least not since I refreshed my screen a couple hours ago. But that's the funding opportunity announcement number that was listed in the forecast that you'll be able to search for once it's available. And then the Office of Head Start, as I'm sure you've seen, has prepared their own toolkit. The Office of Child Care Technical Assistance Network has also organized a lot of the existing research and resources in ways that may be more accessible for child care partners. So if you're trying to explain to existing or potential partners how different aspects of partnerships work or how different parts of the standards work, those resources may be well-oriented to sort of the child care language and lexicon and all of that. I'll leave those up for a minute. I think our next slide just has some question information. I'll go through the questions that are coming in the questions box, and then also take a look at those of you who raised your hand and try to hear some of your questions over the phone as well. So for Mary and Wasi, let's get to these. How have your partners responded to possibly having to lower the slots that they serve in order to be in the partnership?
Could you repeat that again, Emily? I'm sorry.
Sure. So in some places, depending on licensing and how it compares to Head Start standards, partners would have to lower the number of children they served. Is that a conversation that either of you have had to have?
That is a conversation, yeah. Because they would have to lower their numbers, and depends how many kids they have that are privately paid. They don't want to lose those kids, but most of ours are subsidized children.
Yes, in one of my partners, they had to lower the slots. So what I had to do was I had to pay them the child care portion, what they would have had. We kind of agreed, that I would pay one and they would let go of one, because what I also bring is the enrollment. We are very good at enrolling. We in Head Start, so even if they had those slots, they weren't able to fill them. And so that's an argument we bring, and it really works for us. So we've been able to do that. For now, the new partners, we're still talking, we're discussing, because I only have center-based slots, and my center-based partners cannot expand. I mean, they're just individual standalone schools. So they want to expand, they want to do more, but they can't. So I'm looking at new partners, and with the new partners, I'm having the same kind of conversation.
Thanks. Here's someone asking, they're a Head Start grantee for 2 catchment areas, and I think this is a question we may not be able to answer without the funding opportunity, but it says, do you know if we could apply for one large area, or do you have to pick one existing service area? My own understanding is that there won't be the same kinds of limitations to particular existing service areas, but I would not want to give, I don't have a firm answer until it's out.
I think because it's a new grant, this is Mary, I think because it's going to be considered a whole new grant, you can almost apply anywhere in your area.
Yeah, I think
you're not going to be limited to your grantee location only.
And the reason why this is because also non-Head Start people are applying for these grants, so they don't know what the limitations are. But I, as a Head Start director, I would really, I wouldn't want to go into other people's areas. I serve two cities and one in an unincorporated area, so I would go out into this area. If I would think of going out of this area, I would talk to the programs there. Are you going for the early Head Start expansion? I want to do that. That's how I would do it.
A question for Mary in particular: who provides the comprehensive services in your program?
Well, we do it in combination with the partner. The partner is expected to hire the teacher, and with support from our agency would have the whole educational programming. And then we hire the family support specialist. We pay for the mental health. We take care of the health needs of the children that are identified. So it's they're primarily responsible for the education piece. We're responsible for all the support services.
Great. Do you do any fiscal monitoring of partner sites? I think that's for either of you.
We don't get too much into their own fiscal operations. What we do monitor is their enrollment levels. And like I said earlier, we actually pay them based on their enrollment staying up. If their enrollment falls for some reason below 50%, we would begin to deduct some money from what they get paid. But we've never had that happen. I mean, they've been very good partners.
I think this one's for Wasi. When you provide the teacher for the partner, is the teacher your employee?
Yeah, that's a very good question. Okay, so the teacher that I provide is not for an early Head Start partner. It's for a Head Start partner with it's a college partner, because the way the college is structured, they only have one full-time employee, and everybody else, is a part-time, like a substitute that come in and out. So that just does not do it for the DRDP and all the things that we need. So I hire the teacher. I had offered, it really doesn't matter. It's what works. I had offered to pay them so they can pay the teacher, but with their unions and this and that, they said they can't, they would rather I paid I brought the Head Start teacher, so that's what I do.
Emily, I would say in a previous agency that I worked in, we did hire teachers for a couple of the partnerships, and we don't do that here because that was really hard. This person we hired, of course, had to be hired according to our pay structure and our benefit structure, and they were often in a setting with colleagues who weren't getting the same kind of benefits. So we would much rather pay the partner to pay the teacher properly.
And you know what, Mary, that's exactly what is with one partnership, is exactly what you just said, with one of my early Head Start partners. And with the college, the difference was because the main teacher, she's like a center director teacher. It's a one site.
Right.
And so the others, it's just, they're almost like student teachers coming in and out. So it was able to work there. That's why you really have to look at who you're partnering with to do this. Yeah.
Thanks. If the partnership dissolves after a few years, I think some of you have done this, I think with the sequester, I know you may have lost partnerships. Who keeps the inventory and equipment?
In our case, they kept it because we gave it to them as a startup for this project, and it wasn't like it wasn't a whole building worth of stuff. It was what they requested as some special startup materials.
Yeah. Thanks. And I know that there will be startup funding available. The exact amount, hopefully, we'll get some sense of in the funding opportunity. But certainly, start thinking about what you might need and what particular partners might need in terms of startup. How do you determine cost per child with such a range of match with your varied partners? And I think, Wasi, you talked about that a little bit, but do you want to say that again?
Yeah, that's exactly what, you just determine what it is that you can provide and what they can provide. You just, openly sit down and discuss what is it that we can do. And also you look at what you need to provide your piece of it, your piece of the comprehensive services. If you take all your dollars and you just give them out and you can't do what you're supposed to be able to do, then that won't work for you either, So that's how you determine it. You look at your budget, and they look at what they have and what would enhance them. And I think the negotiation has to be really not just about the money, but really what does it bring for me as the partner now, not just a Head Start coming in, but how would this enhance me? For instance, one of the private partners, it was the food. They really like the child care food program because what I'm doing is I have 8 children for early Head Start there, and I'm providing food for all their 41 infant, toddler, preschoolers because I can. It's just another number to add. So that's what I'm doing. And so that's how you determine it. Don't hold on to it. That's the thing. The money is there to be spent. It's there to serve. For me, those children are my children. So that's how I would say, that's how you determine the cost per child.
And Emily, I think in our case, oftentimes it depends on what the partner identifies as a need or what we agree is a need. I'll give you an example. We've had several partners who really did not have enough just good developmental materials for their children. So they got extra startup in that case. Other centers didn't have a computer and we wanted them to do online assessments of their children. So we provided the computer. Another partner said, I don't need computers. I don't want you messing with my computer system. Just give me more outdoor play. So it kind of depends on what each one's need is, basically.
Yeah.
we stay in the ballpark with the total, but we
Sure.
try to let them have the choice about what their choices are.
So actually, then a good follow-up question, is there anything that grant money cannot be spent on, and is there a recommended amount for pay per child per week? I mean, I think that anything that would be unallowable for Head Start dollars is definitely unallowable for these dollars because they are Head Start dollars.
Yes.
I know I saw that as one of the questions. I mean, I'd say the cost principles pretty much tell you what's allowable and not allowable.
And then with the same kind of documentation, I'm sure.
Yes.
Yes.
And it sounds like from what you both said that the amount, the paid per child per week would vary perhaps with the partner, but certainly with the state. It sounds like you have significant differences in your communities, between your communities, in terms of what child care costs are.
Oh, I'm
Yes.
sure. Yeah.
Yes.
Yeah, that kind of for sure says there's no cookie cutter approach to payment. I mean, I'm really anxious to see how the FOA does read because, I heard Linda Smith one time say, we want this to make it right for the partner to have enough money to run their centers. Well, that in our case probably means, almost half. But on the other hand, if there are other things that we have to do, then we've got to have some flexibility there.
Two questions that go together. One asks for some examples of in-kind, and another asks, can your partner's costs be applied to the non-federal share?
Yes, I'd say
Yeah.
I'll tell you what we do for in-kind because we give them, we call these enhancement dollars to their operation. So we have nothing on the books for, say, the cost of their teacher. So they give us back every year, they give us some documentation about what their teacher cost was plus the teacher benefit. That's a really nice piece of in-kind. The other thing, we try to stay away from space because, if you do space in-kind, you got to have appraisals. Oh, who wants to do that? I don't want to do that. So we try to stay away from that. But if they provide other things to their families that are Head Start families, we certainly take that. And then we have a very strong, what we call at-home in-kind program that we use with our infants and toddlers and preschool children, and we will share that information with the partners as well. And the parents also donate quite a bit of time. Promoting school readiness, of course.
Yeah.
Thanks.
Yeah, I think the non-federal match coming through partners is much higher than just regular, Head Start, because you're bringing in a whole new partner with different resources, with different funding. But the child care dollars right now, if they're federal dollars, I don't know how, I don't know if we can count that. But we do count, like Mary said, all kinds of other resources that they get. For instance, in one of my partners, they get like incredible family support. We do count space because we count it. I don't have a whole bunch of space to appraise like you do, Mary. We only have a few, so we do count it. And then any other resources that they bring along, or any other dollars that are not federal dollars that they bring to the partnership. Right. And those are easily identifiable because you can already write those in, anything else is added. So, and by the way, I do write in my memorandum of understanding how much in kind I'm expecting from them, from my partner.
That's a good idea.
Yeah.
And just to clarify the child care piece, if the state is providing child care funding, it sounds like that could be considered part of the match, but federal CCDBG child care dollars could never be, even if they've been renamed by the state, because they're still federal dollars.
Right.
Yeah, the Office of Head Start has been trying to be as clear as possible on that.
Yes. Yes.
Another question, and this is just a clarification, Wassy, did I understand correctly that your agency pays its partners based on the partner's need, which results in some partners receiving more than others?
It's really
in cash.
It really, it depends on what is the cost there and where else they get their federal dollars from, where else they get their dollars from for child care. Yes.
Great. Any inkling about when the FOA will be released or why it's been delayed? No.
That's for you, Emily, to answer.
Yeah. Marianne, we are hopeful that we will see it this week. I may have bet someone in the office a cup of coffee that they would be late with it, which I have now won, but I am as hopeful as you all are that we see it very soon. can the minimum 72 slots include the early Head Start you are requesting if you are adding early Head Start as part of the grant? So I think what this person is trying to ask, essentially the way that the forecast is written, the basement funding, so the smallest amount of funding a program could request, when you consider the match, would fund about 72 slots, which is what the Office of Head Start has suggested is necessary in order to serve, not only to serve the children, but to have the infrastructure of mental health and disabilities coordination and education manager and all of the other pieces that go into early Head Start. And so this one is asking, I think, if you could break those 72 into both sort of directly administered early Head Start and partnership, which may be a possibility depending on how the FOA is written, but not something I think we can safely answer until we read it. If I didn't understand that right, then go ahead and ask again. Yasmina says hello in the comments to everyone. Will nonprofits be allowed to serve in an area that a grantee operates early Head Start already? So I think would a new grantee be allowed to serve in an existing early Head Start catchment area? I believe so.
Yeah.
But we would hope that new grantees would be applying in coordination with existing grantees, or that existing grantees would be applying for areas that are their own or that are unserved.
I think that what makes the difference here, Emily, is that like in our 3 counties, there could be other child care centers that are going to apply directly. They may not even right now know what we have. You know what I mean?
Right. One question about cost per child wasn't clear. Oh, so this person is saying that OHS requires the sort of overall cost per child. When you're talking about a range, Wasi, you're talking, I think, about what part of that cost per child that OHS gives you actually gets passed on to the partner. So you're still getting about the same cost per child overall. It just depends how much is going to the partner and how much is staying with you for monitoring and all of the other pieces.
Yes.
Okay.
And a good example of that, Emily, is like in our case, we have in our own self-operated early Head Start program, we have 160 in centers, but we have 228 in home base. The cost per child is different in both of those options, but it averages out.
Yeah.
For Mary, what is your typical family support specialist caseload?
Right now it's about 50. It's a little bit higher than we like, but you know, it's that includes families. So we have a lot of siblings, especially with early Head Start children. There are siblings, so it isn't 50 families. It's, you know, it may be 50 families, but it's even more children, I guess you'd say then.
How do you allocate costs when you have multiple funding sources? Is it based on the children's hours of services, or do you do it by each program or by employee FTEs?
Cost allocation is the trick of the day. No. We do it primarily by children right now, except in places like if we only have an early Head Start classroom in one building with a lot of other preschool, then it's not, I mean, it can still be by children, but it could be in that case by square footage. We tend to do it by children.
So cost allocated with partners, or what's the question? I'm not quite understanding this last question.
I think it's when you're allocating money between different funding streams. Are you looking at it as, you know, these dollars fund these hours of the day and these dollars fund the other hours, or is it different employees being funded with different costs, with different funding streams, that kind of thing?
I think in these partnerships, though, Emily, I mean, essentially we're giving, I mean, I'm taking it this method, we're basically giving the centers enhancement dollars to up their budgets. Right. And how they then spend those dollars is really not in our control, it's in their control. So I think, I don't know that the cost allocation question fits with this one as much as your own work.
I think it might make more sense for, like, in the case of some community actions where they'll have their Head Start partner with their existing child care program. It may become more of this kind of an issue.
Yeah, I guess they have to cost allocate. For instance, when we have to cost allocate between Head Start and Early Head Start, like for the management team. You know? And the way we do it is based on the numbers on the FTEs. So okay, so certain percentage always, even when I do training or anything, is cost allocated like that. But for the partners, the way we cost allocate for the partners is, okay, we fund them per child. At least that's what we do. Okay. In the one case where so it's the same amount for every child there, and like Mary said, they can use it for whatever enhancements they use it for. But if I'm hiring a teacher like I do in this one case, then whatever I allocate to them per child is much lower. I mean, I still give them something, but it's much lower. And then something that's out of the cost allocation that is not even, in this child count is what we do for enhancements in terms of playground, because sometimes that can really be, especially at startup, or, it can really be high. You have a partner that has, if you can't have children playing in there the way it is, because licensing, you might lose your license. It might be dangerous, health and safety. So we invest money in that when we have the money, and that's above and beyond. Yeah.
Another question, someone was having trouble finding the partnership agreements that I thought I'd posted from Mary's program. I'll check on that after the webinar.
Okay. I have one for both family child care and the other one, so I'll send them both to you again.
That would be great. When did we say the funding announcement would be available? We're hoping it would be available last week, but we haven't seen it posted yet. Someone says they're looking at partnerships with family child care, especially for an isolated geographic area in their region. Have you had any particular issues with family child care partners, and which partnerships have worked best for you among the family child care private centers or state subsidized programs? I think meaning sort of center-based.
We have some family child care partners for preschool, and they would like to now add some infants and toddlers. They're going to be, in Ohio, the ratio of children under 2 it's lower federally than it is in Ohio. So I'm not sure that they're going to be able to do it, because the loss of one infant or toddler slot will make a huge difference in their arrangement. But we're still exploring that.
That's an issue everywhere. I mean, seriously, because we're only allowed to have 2 children under the ages of 2, so in a family child care home. So how are we going to get to those numbers with just family child care homes? That's going to be, that's something I don't have a response to. I'm, still researching and looking, and I don't know.
Thanks. Can any money be spent on remodeling, for example, adding a bathroom?
Yeah, you could do that.
Yeah.
I think that could probably be included in startup costs. Someone says they've heard you mention MOUs and contracts. Is this type of agreement usually more of a contract?
Yes, it is. Mine is.
Yeah.
Some people, when they do MOUs, they do simple MOU, and then they do a plan of action or work action, and that details it more. But my MOUs are contracts. In fact, in our agency, our contractor says, "Why do you call them MOUs, Wasi? These are contracts." Okay, yeah, they're contracts.
Yeah, I guess they are.
Someone asks, is it possible to ask for home-based slots through this? No, it is not.
No.
The Office of Head Start has been quite clear that while the maternal, infants, and early childhood home, well, not the Office of Head Start, the administration has made clear that that the home visiting funding is available through MCV and the ACA, and that this opportunity is primarily for center-based services. Question, you mentioned looking for the same kind of documentation, meaning it's the same kind as Head Start for expenses and in kind. How would that work with a partner if they're being paid a rate? Would you have to look at their books to be sure the expenditures were allowable, since they're not exactly delegates?
I think how you write your agreement, I mean, we basically write it as we're enhancing their operation. So, I don't know about that one. We'll have to see how the FOA does come out on that one.
Well, so far, all these years that we've been doing Head Start, only Head Start partnerships, it has never come down to that. How are the partners at cost allocating?
No.
As long as we say this is what it's for in the MOU, and they bill us and we pay them these lump sums.
Yeah.
A question: you can't claim child care dollars for the same time the same service that you're claiming early Head Start dollars, true?
Especially if they're federal child care
Right.
dollars.
Yeah.
Okay. How do you allocate expenses when, for example, you might have a partner whose enrollment is half early Head Start and half CCDBG or self-pay, and your mental health consultant or nurse provides services to all the children at the site? Or would you have your staff provide services to all the children at the site?
Well, I can tell you we have a really strong mental health program. So when our mental health people go in, they're taking a look at the environment. I mean, there's 2 observations a year. If they notice a I hate to say it this way, but a non-Head Start child that needs some attention, they're not going to just ignore that child. They're going to talk to the director about this child looks like they could benefit from a referral, and here's somebody you could call or talk to the parent about. So they'll still pass on the information. They may not do the actual therapy work with the family or the child.
Mm-hmm.
And my
Never
agency,
just forget them.
yeah. My agency is a behavioral health agency, so we do provide mental health services to our partners, and kind of the same, like you, Mary. But we also provide direct services to them because we can bill
Medicaid.
Medicaid. So we do that. This also becomes part of our MOU. That this is an enhancement we bring to the whole program.
Mm-hmm.
Yeah.
Mm-hmm. A couple quick questions that I can know the answers to. One, the first is, will the slides be available? If you'd like the slides, you can email me. My email is there on the screen, and I'll also be sending out a link to the video if you want to watch the webinar again. Do teachers in Early Head Start center-based need a bachelor's degree?
No.
According to the Head Start Act, all they need is a CDA with an infant toddler focus, which could be the Family Child Care CDA or the Infant Toddler CDA.
Right.
Certainly, if a program has chosen to set a higher requirement for their teachers in their program's bylaws, that may be the case.
Yeah.
Mm-hmm.
Then, if you have center-based, do you think a model that provides home-based for the summer would be acceptable? Is Early Head Start center-based typically year-round in your program?
Yeah.
Say that again. Early Head Start?
Yes.
Center-based? Oh, yeah, it's year-round.
Yeah, year-round.
Okay.
Now,
So
that's an interesting question, though, about summer, because might that be called a modified home, or what's that called? Combination option.
Mm-hmm.
Might you do center-based during the year and then do a and then switch it to center-based? We've thought about doing that with 2. I really want to do this, and I don't know whether we're going to be able to, but we've got 2 high school situations where we could probably work with the high school teen moms, but not during the summer. So what would we do, and would that even be allowable? I'm really anxious to see the FOA to see if we could write a program that would be a school year program for teen moms and then switch them to home base in the summer.
Local design. That's a local
should be.
design. Yeah.
An interesting thought.
Easy for me to say it should be.
Would have been good if you'd experimented with what you already have, Mary.
Yeah.
So a quick question on the CDAs. Could you work with a staff of partners over a period of time to get their CDA? And I think that the Office of Head Start has suggested that that's acceptable, as long as it's clear that there's a goal and there's progress. And a clarification on the toolkit, it mentions that partnerships work with existing regulated child care centers and family child care homes. Is that your understanding?
Yes.
Okay.
Yep.
All right. Thank you guys so much for your time. That is the end of our official typed list of questions. Mary, Lakeisha Smart-Penix, if you know her, says to let you know that she's operating exactly, or just the model that you described as a locally designed model.
Who was that?
Lakeisha
Chicago.
Smart-Penix in Chicago.
Oh, I know Chicago. Okay.
If you want to ask her. So those are just the kinds of things that
That's great.
great when we can have
Emily, on the first slide where you have our names listed, you've got
Yep.
my agency as Miami Valley Community. It's Child Development Centers.
I'm sorry.
You got it right on the next one, just in case people need to contact us.
All right.
Yeah. And you can put as far as I'm concerned, put my webpage or something, my email on there if you want to.
Okay. I don't think we have it up right now. I'm not, but Folks, if you want to get to them and you don't know them already, feel free to email me. My email is there, and I can put you in touch. I think we've answered all of the questions that have come in, so I will say thank you hugely one more time to Trevor and to Mary and to Wasi for joining us today. Really wonderful information. I know we've had a lot of people join us today, which is great to see the interest, and really hope this has been valuable. We do ask that you all take a quick survey at the end. You'll see it pop up on your screen when we close the webinar. And you'll have another chance there to let us know if you'd like to get some more information from Community Playthings and some copies of their tools. Do any of you all on the line want to say any last words about the partnership?
I just want to say happy writing.
Yes.
Just what we want to do in the summertime.
Oh, yeah. Ditto. Happy writing.
And good luck to everyone.
Great. All right. Well, thank you all. Have a great day.
Thank you.
Thank you,
Thanks, Emily.
Bye, everyone.
Bye-bye.